Thank you, Jeffrey. I mean, that's an amazing introduction. Let's see. I was kind of hoping that I would be able to see these slides, so I know what we're going to talk about. Right. All right. Let's see. So we go this way. So yes, I do research at NYU and at Nonduality Institute, and I'm interested in the nature of consciousness, and I'm interested in kind of trying to change or bring in a new sort of a topic to the neuroscience of consciousness, and that is to actually not look only at the contents, in other words, specific experiences or at the different states of consciousness, but to actually look at the consciousness itself. And in that sense, Asian non-dual contemplative traditions, like many of those that you know, like Dzogchen or Mahamudra or Advaita Vedanta or Kashmiri Shaivism and so on, Zen, they have something very important so that we should kind of pay attention to and try to research scientifically. So, put very simply, experience, our conscious experience, that is our consciousness, and perhaps even reality itself, is singular, but it has two sides, right? So this experience we're having right now, sitting here in this room, there are two sides to it. One is that there is changing experience, there are sensations, there are perceptions, there are emotions, thoughts, and so on. These form the relative aspect of experience. And then there is a relatively unchanging background awareness that makes this a conscious experience. And this awareness is there in all conscious experiences. Sometimes this awareness can be called absolute. We call the other side relative. These are just the terms. They go together, right? In some traditions, maybe one is emphasized more than the other. But same way that if someone gave you a quarter, right, and it has only one side to it, you wouldn't take it, right? So likewise, it can't be just absolute or just relative. It's the two together. Now, what happens with these two aspects of our experience is that they get reified, they get conceptually solidified, and conceptual structures get built on top of them, and we end up in a divided space, in a way of normal experiencing in which experience is fragmented between subject and everything that's not a subject, in other words, an object. And this fragmentation propagates through everything that we experience. Yeah? So we experience everything in terms of these dualities of self and other, good and bad, mind and body, and pick whatever, whichever one you like. Now, some people have said, this really doesn't matter. This is just something that psychologists and philosophers invented so they have something to do. It's kind of irrelevant stuff. But I don't think so. I think this is actually, just as meditation traditions understand, this is a source of much suffering in this world, and unnecessary suffering. So, better way to experience life is to rediscover the actual nature of our experience, of our life, which is the non-dual, that it's actually, it has a non-dual quality. So, so the non-dual thing has two sides. One is that, as I said, is that we can optimize our body and our emotional life and our mental cognitive life through a variety of practices. And also, we could actually approach and directly realize and recognize what is this that's aware within us. And the metaphor that for these two that's often used is the metaphor of a mirror and the images in the mirror. So the awareness is like a mirror, and the experience is like an image in the mirror. And an important point there is that no matter how much we perfect our body and our emotions and our mind, it's not going to, by itself, give us realization of awareness, realization of who we ultimately are. Just as no amount of improving the image in the mirror will make the image become a mirror. Yeah? It's the two are together, but they are different. Very importantly, no matter what kind of image is appearing in the mirror, it doesn't affect the mirror. Right? The mirror doesn't get spoiled if the image is ugly. It doesn't get improved if the image is pretty. That's a key to becoming free, because when we realize that the nature of our experience doesn't fundamentally affect the awareness, it doesn't fundamentally affect who we are at the foundation of ourselves. So these things have implication for transformative technologies, right? We would like to have a transformative technology that it doesn't just optimize or help us to optimize the body and the emotions and the mind, but actually helps us to realize who we actually are at that level of non-dual awareness or fundamental consciousness. All right, but unfortunately, things are not as easy, simple like that. Through many centuries, different types of experiences and realizations have been attached to this world non-duality, and today, of course, you can encounter all of them. So one interpretation is that non-duality is a cessation of all experience and all cognition. You are in a kind of a state that's like a deep sleep. You don't cognize anything. You're not aware of anything. You don't have any experience. And then retroactively, when you come out of it, you think, okay, well, that was nice, and I was non-dual because I didn't experience anything. And then another way is to go like, okay, so there is this subjective side of experience, there's objective side of experience, and there is a dichotomy between them. We can just shut off one of the two sides and only have one. So if you shut off the subjective side, you can say there is no self, there is nobody home, there is nothing here, and the only thing that you experience is the objective relative side of the changing sensations and perceptions and thoughts and emotions. Or you can flip it around and say, it's the experience that's bad, and I'm just going to shut off all the experience, and I'm just going to stay within my own self, with my own awareness and subjective experience. And these are, I would call them the incomplete non-duality. To actually realize who we are, we have to realize it within the experience that we are having now or at any moment. So both the awareness side, the absolute side, and the experience side or the relative side. Now, it seems like that our brain is organized in such a way that indeed there is a neural sort of underpinning to this duality. When we look at the various networks in the brain. We can ask them mathematically. People have done that. And we can see that actually all the areas in the brain fall into two very large systems. The intrinsic system that deals with the subjective or self-referential experience, and the extrinsic system that deals with what's other than yourself. So the environment, doing the task, anything other than you. And the two systems are anti-correlated. That is, if you are just lying and resting and doing nothing in the scanner, over this period of time of 10, 20 seconds, we see a very slow fluctuation where a whole bunch of areas become more active, and then they subside, and then some other areas become more active. And these two systems, the areas that belong to the two systems, they alternate. So there is at the foundation of the brain, there is this dynamic of the spontaneous, slow oscillations. So they're very slow. They're like, every 10, 20 seconds. But there is, what they reveal is the brain's innate organization, dynamic organization. There is a kind of a obvious correlation to our experience. When we are focused on a task or something other than ourselves, we're less aware of who we are, and vice versa. If we are thinking about what our significant other meant by what she said, then we are not paying attention to as much to the external environment. We're thinking about our own stuff. So these are natural oscillations in the experience and in the corresponding brain activity. Now, when people look at what happens to the brain for those who practice cessation-oriented non-duality, that is, when people are essentially trying to quiet down and shut off their experience, including awareness, generally what has been found are global decreases in the cortical activity. So the blue area generally in these kind of images means that activity is decreasing, let's say compared to rest or some condition that we're comparing. So, and that makes sense, right? If you are kind of going towards a nice little nap, like you're in deep sleep, the brain generally quiets down and slows down. If, on the other hand, you are de-emphasizing your subjective experience and you're emphasizing objective side, and you are paying attention to sensation, or you're paying attention to something while not self-referencing, what we see is that, here we go. So what we see is often a lot of areas that are on the lateral side of the head, they become more active, and the areas that are in the medial side of your head become less active. So these medial areas are often involved in the self-referential process, and the lateral areas tend to be involved in extrinsic system. And we also find exactly the opposite. When people do practices in which they're focusing on themselves, on their own subjective experience, on a sense of self or their own subjectivity, the areas that are more lateral quiet down, and the areas that are more medial become more active. So what we have done is then looked at what happens for people who actually can find this awareness and have a kind of a more of a non-dual presence. And we find that this image is a little bit complicated, but we find that, let's say this is the kind of a level of anti-correlation in the middle during the rest. When people focus very strongly, they induce the two systems, the extrinsic and extrinsic, to further become independent from each other, to further separate, which is normal. That happens to us every time we focus on something strongly, but it happens very strongly when people are good at one-point attention meditation. And on the right, we see that in the awareness meditation, where awareness is open and there is a non-duality of awareness and experience, an internal and external experience, then this goes in the other direction. The two systems that are generally anti-correlated, they become more positively correlated. We say that they become more functionally integrated. And that corresponds to our experience. When we can rest in the open awareness, then our experience becomes more harmonious and integrated. So one question that we asked is what is it in the brain that actually facilitates this integration? And our finding was that it's precuneus, which is the part in the medial part of the parietal lobe. And this area forms kind of a context network so that it connects the intrinsic and extrinsic systems into a larger integrated system. We'll skip this. And this is not without precedent. Those who study loss of consciousness in patients that have brain diseases like epilepsies that lead to loss of consciousness do also recognize that in addition to brain needing a sufficient amount of stimulation from subcortical areas, like these in the red, critical thing that has to happen is that the areas in the middle of the brain and areas that are lateral need to have integrated functioning. So even for our ordinary experience, there has to be some integration. If that integration falls apart completely, we lose consciousness. But when we have this, what like 100 years ago people used to call superconscious experience, but really it's just a realizing your own awareness, then there is more of integration between these areas. Okay, so now if everything was that simple in the brain, so here's the point that I want to make sure that I mention. So we all read about and talk about brain being a complex adaptive system, right? So it's an extremely complicated a system that's continuously adapting and self-organizing. It's organizing itself, and our experience in a certain way is the result of brain's innate attempts to organize itself plus whatever we're experiencing from the outside. And sometimes I think that when we think about making the devices, we tend to, or any kind of a protocol to assist what the brain is doing, we tend to kind of fall sort of to the default way of thinking, which is that kind of deterministic mechanical thinking, right? Like if I push this lever, then that lever moves, right? So if I input this in the brain, then I'm always going to get this one same output. But it doesn't work like that. The brain is too complicated. And also very different from one person to another, even though similar in many ways. So this has to be taken into account as we go further with these developments. We want to be able to have devices that actually individual can calibrate themselves and take into account the complexity of the brain. So in the meditation results, very often things are not entirely neat, and that has to do with the style of meditation. Very often the technique that we are practicing to get to someplace gets actually measured rather than that place where we are trying to get to with the technique. Different phases of the practice, how experienced you are with it, will have different signatures, and sometimes even the, how we set up the experiment will affect what the results are. So one of the things that's currently being debated, for example, is why certain practices have certain types of benefits and not others. For example, mindfulness practice has been found to be helpful for anxiety, for depression, for controlling pain, but not so much for cognition, not as much as we expected. Like there's a little bit, tiny little bit effect on attention, but why? Why not much more effect on cognition? And the reason is simply that different techniques mobilize different systems in our organism, in our brain and in our body. So techniques that use relaxation and quieting down of the mind generally activate parasympathetic system. And this is the most popular thing. I think many people even think about meditation is just switching from the sympathetic into parasympathetic system. And this is very nice for distressing, it's very nice for lowering your blood pressure and so on. But it has zero effect on increasing your cognitive capacity, right? It doesn't help you with that. It's a different type of thing that you need. What you need actually is the other system, the sympathetic system. Sympathetic sometimes is called fight or flight, but it's gotten a bad name because people who study it a lot are people who study PTSD. It's not a bad system. It's a system that you need all the time because you wouldn't be alert and awake without it. So meditations that actually increase arousal, that charge you and wake you up, like the visualization meditations in Tibetan Buddhism, like the Kundalini yoga in Hindu traditions, they actually have a much better, more effect on the cognitive aspects of the mind. And so this is something to realize, actually, when we are studying meditation and when we're making these devices. Mindfulness also has different effect depending on what stage of your practice are you at. For example, in early stages, you need much more control. You are supervising yourself much more. You are learning the technique. So it has a different signature than in later stages where it's more effortless, and you are essentially kind of alerted to the experience of what's arising. This is just came out. I want to thank Jeffrey for alerting me to it from Tanya Singer's lab. Different areas with different practices. Mindfulness like a practice of attention, essentially, to present experience, versus practice that has to do with affect, versus practice that has to do with understanding another person. And increases over a 3-month period of time, increases in the cortical thickness compared to controls. 3 months time, anatomical change in the brain, right? Even actually less. I think there was a study not that long ago, 8 hours of meditation in one meditation day, change in the anatomy of the brain. So there are different ways and different methods to get to non-duality. Some are direct methods that deal with awareness, but there is also an affective method or emotional method that has to do with generating non-referential or non-dual love and compassion. So as you know, all religions have these methods. These are methods where you can cultivate feelings of love and compassion for others, sometimes towards a deity of some kind, sometimes towards other people, And at first, they are, they are basically exercises to free us from our own kind of a conditioned and limited way of loving and being compassionate towards others. Yeah, our normal way is a transaction. Yeah, I'm going to love you if I get something out of you. Yeah, basically that's what we do. That's what we do with kids. That's what we do with other people. Yeah, we want something in return, and if we're not getting anything in return, what's the point? So, but non-dual love and compassion is different. It's really a property of your being. It's a property, actually, of your consciousness. And just as your awareness pervades throughout the space of your experience, your love and compassion pervade throughout the space of experience. You don't have to do anything about it. You just have to discover it. All right, so we did the love and compassion experiment, not quite as highfalutin as that. We did it with people who have implanted electrodes and are waiting for a surgery to treat the intractable epilepsy. So epileptic seizure is a disorder in which it's a disorder in which seizures are occurring frequently. As I've learned from a neurosurgeon who was on the team, something I really didn't know, that seizure for the brain is like coughing for lungs. Right? So brain can do seizure for all kinds of reasons, and sometimes these reasons are totally benign. They don't mean anything. But if you have a repeated thing, seizures, then it's diagnosed as a disorder, and sometimes for some people, unfortunately, the seizures can happen many times a day, which means you don't really have much of a life. So here are the actual photographs of the patient's brain. The skull gets opened, and electrodes are placed on the surface of the brain, and some of the electrodes are also depth electrodes. Here, red grid are the electrodes that are placed on the surface. Also, the blue ones are the stripes that are also right on the surface of the brain. On the right, the green dots show the electrodes that are placed very deep inside the brain. These are microelectrodes, and they are left like a week or so. The skull gets closed. The wires are coming out of the skull. They are hooked up to another room, which has all the monitors for each patient, and the video that's synced to the EEG. And so the patients are monitored 24/7 over the number of days, and the data is used for the doctors to determine where in the brain the seizure is originating. So for larger percentage of seizures, the seizure originates from a diseased part in the brain that's fairly localized, and that's good for the prognosis of a surgery. Sometimes it doesn't. Sometimes it's very diffused and has unusual types of things, and then the surgery is not the way to go. But here you see an example of a patient who had a localized source of seizures, and if you can see, I don't know if you can see this, but in these crosshairs, you see a tiny little black point. And that black point is the area of the brain that was taken out surgically with laser surgery, and the subject has a reduction something like 80-90% in the seizures that they experience. So they can regain life as a result of this kind of surgery. Now, when subjects are... So seizure itself is a very loud, synchronized activity that propagates through the whole brain at a very slow rate, at about 4 times per second, or in delta range, so 1 to 4 times per second, and it disorganizes the brain completely, so that person is not experiencing anything when they're having seizure. They're not conscious. There's no experience. But even when they're in the period between the seizures, there is a kind of a disturbed hypersynchronization, particularly in the area that's affected or close to the seizure site. So here what we're doing is we want to see what happened in the brain for subjects after they did a love and compassion meditation for about 20 minutes. And this is a guided meditation. We did a guided meditation, make sure that there was no entrainment that could trigger a seizure. And one of the things that we see is here the red means more hypersynchronization, and blue means less. And different frequencies are going down from a slow to alpha, theta, beta 1, beta 2, gamma. And we see that after 20 minutes, this first row is a resting state, then the 20 minutes of then meditation, the drop in the hypersynchronization, and then even after some other task, resting period at the end still persists in the decrease of that hypersynchronization. So of course, we want to know why something like love and compassion meditation has such a powerful effect on seizures, where some other meditations, where, for example, subject is trying to focus very strongly, or they repeat a mantra at a particular rhythm, have actually the opposite effect. They increase the hypersynchronization to a point where actually they trigger a seizure. So what is this difference? Well, we're still working on this. This is a time warp analysis of all the channels. Usually people have like 100, between 100 and 200 different electrodes altogether. And that result we're going to submit to Museum of Modern Art. All right, thank you.